whatever passion you have, whatever population that you want to work with, I think is out there for clinical psychology. There's enough people out there that are going to be able to align with whatever passion that you have. What's up, fam? Welcome back to the channel. My name is Phil Sarpon. This is Phil's Guide to PsyD. This channel is dedicated to all things clinical psychology. If you care about psychology or wellness, or even if you want a little bit of a sneak preview into what grad school might look like for you, then this is the channel for you. So today we're going to be talking about why I decided to choose clinical psychology. I have three main reasons. So one of the things that I love about clinical psychology, and this is probably the biggest reason that I chose clinical psychology, is that there's just so many different options that you can do with this degree. I've kind of already talked about it in previous videos about how you can do research, how you can do clinical practice, so you can do therapy, you might be able to prescribe medication to patients, you might be able to teach, you can do so many things with consulting or work for a company. There's just a number of things that you can do. And honestly, when you look at the PsyD field, the PsyD field is actually fairly new. It started around the 1970s, and so it's only been going around for about 50 years. And so honestly, I'm super excited because I think as time goes on, I think this field is going to be able to evolve with the time. It's not so much of a stigma. It's one of those things that people are casually talking about it. People are actually going into mental health fields. People are going and looking for mental health services. So I think that the number of people that are going into these fields is going to increase. I think the number of people that are wanting mental health services are realizing how crucial and important mental health is. And so the diverse range of options for clinical psychology, in my opinion, is only going to grow from here. The other thing that I love about clinical psychology, and it's also a really important reason why I chose clinical psychology, is that honestly, you can make it into whatever you want to make it. You know, I already talked about sort of the diverse options that are out there in terms of what you can do with clinical psychology. But honestly, if you have a passion for helping people with eating disorders, helping people with trauma, helping people with sports and sports psychology and looking at concussions of athletes, whatever passion you have, whatever population that you want to work with, I think is out there for clinical psychology. There's enough people out there that are going to be able to align with whatever passion that you have. And so I value that about clinical psychology because I actually come from a physical health medical background, and I love the human body. And the fact that I can take my passion for the human body and kind of couple it with mental health is great. You know, I'm a personal trainer, and so I'm always looking at the physical health. But I also know that physical health also kind of aligns with mental health as well. And so for me, being able to kind of couple those two things and kind of have a little bit of a uniqueness to how I go about my practice with clinical psychology, I think is going to be very unique. And so you may have other interests or passions that are unique to you that you may be able to marry with clinical psychology and make you more distinct and different from everybody else. The other thing that's great about clinical psychology is that, well, one of the things that's really important is that there needs to be way more representation in the field, whether it's with minorities, sexual minorities, whatever it is. As clinical psychology continues to grow, the field needs to become more diverse in terms of the professionals. Most people will feel more inclined to go to someone that they can have a little bit more similarity to in terms of their background or their interest or where they come from. And so I think that's really important, as well as that whoever you are, whatever unique passion or interest that you have, you can actually infuse that into clinical psychology and use that to help other people. Now, the third thing, which I think is probably the most important reason of why I went into clinical psychology, is honestly just to help people. I know there's a lot of different careers that you can go into to help people, but there's something that's very special and unique about helping people with mental health services. Now, don't get me wrong, this field is definitely intense. It can be emotionally draining. There's just a lot. And so being a person that can handle that type of emotional fatigue, and honestly just being a person of wanting to journey with other people, I think is unique. I think there's only a couple other careers that go along with that. I mean, I think about physical health careers like being a doctor, being a nurse, where they may kind of coincide with some of the emotions of their patients. But it's one thing to actually directly just focus on mental health rather than physical health. And so there's something very special about just being able to journey with someone along their journey when whatever they're going through, whatever struggle, whatever anxiety, whatever thing that they're going through. I think there's definitely a humility about it as well, where it's like, man, yeah, I don't know all the answers, but whatever I do know, whatever I can do, I'm going to journey with you and help you along the way as much as I can. And at the end of the day, you're just trying to basically give people the tools to help themselves and to be independent on their own. I think that's one of the most beautiful parts about clinical psychology, and even just overall, just general therapy as a whole. But even in the psychological side, when it comes to psychological assessments, there's a number of things that psychologists can do that really helps people out. It really shows them, oh, okay, this is who I am. This is why I've been doing the things that I've been doing. This now makes sense. I love how you can actually use whatever passion or interest you have and couple it with the field. And I also love how you can just help people. Those are 3 reasons why I decided to go into clinical psychology. I would love to know the reason why you guys decided to go into clinical psychology, whether you're already in clinical psychology right now, or whether you're a graduate student, or whether you're thinking about grad school. Put down some reasons why you want to go into this field. I'd love to kind of see those reasons why. I'm sure there's a number of different reasons why people want to go into this field. But with that, guys, if you haven't already, definitely like the video, subscribe to the channel, and I will see you guys in the next video.